I'm Kirk Calhoun, MD. I'm president of the University of Texas Health Science Center at Tyler. The Health Science Center at Tyler is focused on training the next generation of healthcare professionals in rural medicine. We have a 100-bed hospital, and we serve pretty much all of Northeast Texas. There are other hospitals, but we're the safety net for that region. And because of all that, healthcare reform has been something that we've been watching very carefully. The concerns about DISH funding, very meaningful to us. The changes in reimbursement in general is going to be quite meaningful to us. Out of healthcare reform, the Texas Medicaid rolls will expand by at least 1 million people. And what is that going to look like? What is going to be the impact of public hospitals, whether they're in the big hospital districts of Texas and Houston and San Antonio and Dallas, or the state-supported rural institutions like mine? How are we going to adapt to a new normal that's going to come out of healthcare reform? Many of the healthcare reform issues will be resolved over the next few years. We have time to have impact on that, and we expect NAPH to play a big role as many of the as the rulemaking takes place, and the Secretary makes some very critical decisions about how all this will work. And I certainly believe, and I don't know of anyone who believes, that the issue of healthcare reform is now over. We've been working on fixing Medicare since 1965. I think we will be fixing healthcare reform in the United States for an equally long period of time in the future. And my daughter, who's studying health policy at Rice University, I've told her that when she is my age, they will still be debating health policy and healthcare reform in the United States. So we have an awful lot ahead of us. We're going to have to be involved. NAPH offers public hospitals an opportunity to become involved in this debate and to help shape our future.